Thank you very much. And I can direct the presentation with this. And first of all, excuse me for doing this annoying thing of not speaking to you in your very important European Union and world language, and also for being a doctor of law in, a place where, probably many more important doctors are here. But I'll be speaking today a little bit about eHealth innovation from the EU perspective, what we can do on the European level while you're doing things on the regional, on the national level, where you're, of course, very well aware that health is an area very much subject to subsidiarity. So we help with the internal market, with the digital single market, also with coordination, but the health system choices are yours. I'll say a little bit about the eHealth Action Plan, where we're starting a midterm evaluation. So we would very much welcome your inputs, where it has been useful, where we've missed something, where we can make it more useful. The Connecting Europe facility, this is to connect up with the electronic health summaries and with e-prescriptions, all of our member states that are implementing those, so the traveling citizen can gain the benefits. There's a call and European financing available. Also a follow-up to our policy paper, the Green Paper on mHealth, a code of conduct on mHealth privacy, guidelines for assessing app quality, and an upcoming public consultation on a legal framework for apps and non-embedded software overall, and then research opportunities in Horizon 2020. This is coming from the eHealth Action Plan, and I think it's not news to you that there are needs for changes in healthcare. In all of our countries, we see an aging population, less resources, an increased demand for a higher quality of care. eHealth services and tools can be part of the solution, obviously with changing the way that we're working. Better management in diseases, effective prevention, obviously, which is one of the goals that we have held out for many years, sustainable and efficient patient-centric health systems, and better conditions for developing new products. I don't have to say in Germany that innovation is obviously an export from your country, from the rest of the EU, that can help us to continue to compete on the worldwide markets. The eHealth Action Plan, the operational objectives, interoperability, making sure our systems work together, not to harmonize, not to have the same systems or exactly the same approaches, but making sure that information can move with the citizen, with the patient, with the company if it's a commercial offer. Supporting research, development, and innovation. Ensuring wider deployment and uptake, making sure the things that are being developed by your research, our research, where we're working together, can then see the light of day, can be procured in public procurement of innovation, for instance. Promoting international cooperation. We have a memorandum of understanding on eHealth with the United States. This is also, again, to make sure while we as Europe and North America are still quite important on the world stage, that we can have some standards adopted. Also, it's looking to export markets for our companies in the United States. The action plan encourages the European Commission, member states, and stakeholders to work together. As I said, without this kind of cooperation, it's not something that the European Commission should be working alone. And obviously, if it's just a region working alone, you can't get the benefits from either the internal market or make sure that your citizens are receiving care based on good information if they're in Spain or in other places that they like to travel. The Connecting Europe facility, development and deployment of eHealth is the responsibility of member states, but the Connecting Europe facility supports the member states in developing and deploying the solutions, and the use of this financing is a good opportunity to facilitate the deployment of eHealth cross-border services and digitization of health services in general. On the call for proposals, they're open until the 15th of March. Again, this is European financing. The CEF selection criteria: have sufficient maturity to be deployed, contribute to union policies in support of the internal market, create European added value and long-term sustainability, and comply with international and/or European standards. So we have the deployment of the EPSOS eHealth services for €15 million. This is for the patient summary, again, when the citizen is traveling, is skiing, not just in your country, in your Alps, but let's say in Austria or in Spain, that they can, if they need emergency medical services, they can have their patient summary available to the treating doctor, e-prescription where it's offered, that also the prescription can be filled in other member states, and the European Reference Network, which are these centers of excellence, for instance, for rare diseases, where, a big and very important country scientifically like Germany can help some of the smaller member states where, for instance, rare diseases are perhaps not addressed by so many experts. And of course, you can benefit from the scientific achievements in other member states. On the intermediate evaluation, I already briefly announced this. We want to identify also areas in which more in-depth actions could be taken, pointing out new topics that have emerged since the publication of the action plan in December 2012. A little less so with medicine or health, but digital is an area where things move very fast. We did foresee the issue of apps, for instance, in 2012, but if you would have looked back to the discussions in 2009 or 2010 when I took over the unit, the apps weren't something that was foreseen. Perhaps in 2020 there's going to be something else, biological computing, etc., which is on the horizon, but we didn't address yet in the plan. So again, we're very open to the inputs from the medical community, the scientific community, patients, and others, whether there are things that should be added, that should be addressed. Moving now to our policy document on mobile health, which of course has a great deal of potential, not least of all in the data that it is making available. The area where we were asking stakeholders for their input, so the areas, were data protection and security, big data, the legal framework, patient safety, eHealth's role in healthcare systems. How can it help us give more efficient, more patient-centric healthcare, perhaps again achieve something on the prevention agenda, keep costs down, but keep our citizens healthier. Some of the answers that we got from quite a few stakeholders were that safety and performance requirements and lifestyle and well-being apps should be covered by legislation, soft law, or quality labeling certification. The need to clarify the borderline between medical and lifestyle and well-being apps, and the need for strengthened enforcement of medical device and data protection legislation. This is again what stakeholders, what citizens and others were saying. Results of the consultation shows up now. Not pushing the button enough times. So here on privacy and security, in following up, we took an action to have a code of conduct on mobile health apps covering data protection and security principles. It's going to be signed by the main parties involved in the processing of data in the apps environment, and it's going to be proposed to the data protection authorities of the member states, so of course including Germany, for their approval if they wish to approve it. The legal basis is an article in the Data Protection Directive in the new regulation for those of you who follow these things. There's also an article actually even given a strength in place for the codes of conduct. The objectives are increased trust, raising awareness with data protection at the EU level, a competitive advantage for those companies that are following it. It's an industry group with the European Commission facilitating it, and I think it is an interesting exercise in that, of course, we have European companies and European associations. It would be strange if we didn't, but we also have the major world players involved in this group, Samsung, Google, Apple, so in a way it has the potential to be a world code of conduct. We often hear from our own enterprises, others, about a level playing field. We put a stricter rule in Europe, perhaps, but people will ignore it in the rest of the world. In this case, the big companies from the rest of the world are volunteering to be part of the process. So, as I said, the first quarter of this year, it should be presented to the member states, and they will check, the data protection authorities, that it really lives up to what is required. This is a very new group that has just been set up and hasn't met yet. And this is how to make the best use of the data that is coming off the smartphones, the eHealth apps. Obviously, this is one of the areas, if this data is going to be used in electronic healthcare records by member state healthcare systems, this is their choice. It's a choice for the regions. So these guidelines are just to assist. They're not even soft law. They're just guidance. But the idea would be to have experts say, how can you assess which apps have data that's of the required validity and reliability? I mean, this could be on things like calories, it could be things like on sleep patterns, etc., but that might help a doctor or help the citizen in, how to say, planning a healthier lifestyle. First meeting planned March 2016. We foresee the guidelines for the first quarter of next year. And then the final follow-up, this will be a public consultation that will be opening up in the near future, also as part of the stakeholder inputs to the green paper. We got the input from quite a few stakeholders that they saw if there was a so-called bad app or software that was not functioning and it was non-embedded, so just on the app stores, just on the internet, that there wasn't a way to take it off the market even when it was shown to be malfunctioning. You may know the famous case of the melanoma app that was misdiagnosing. That probably should have been a medical device, but because they themselves said it wasn't a medical device, it fell into this area of being a lifestyle app. And the Royal College of Physicians, for instance, in the UK, had great difficulties in finding someone to complain to. So here we're looking, is this a legal opening, a legal hole that's just there? Or is it a problem that requires some action at the European level? Of course, this is a digital area, so things very quickly cross borders. We are not right now proposing any kind of legislation. We want to make sure that there are low barriers to entry to putting an app on the market, but we're trying to see, are there many cases of such problems, and in which case there would be discussions of how to act further. Looking forward more, in Horizon 2020, this is our area of research, and we spend about 100 million euro a year, of course, available to the researchers from all the member states. The focus from our side, I said I'm coming from the Directorate General, that's the digital single market. I'm not in the health, the Directorate General is on competitiveness, but obviously in producing a set of goods that at the best price can be procured by the member states' health systems or used by citizens directly. So there's research on health and well-being solutions, a user-centric approach. A long-term focus on the virtual physiological human. This is the modeling of organs, other systems in the human body. On innovation, user-driven innovation is a focus, as well law incubators, legal advice for startups, for new enterprises, for instance, on data protection, patenting, other areas that are important. And I mentioned again, a focus is on your health systems getting the products that you need, so pre-commercial procurement and public procurement of innovation, working with member states, health systems, them making the choices that they want to and need to, and with financing assistance by the European Commission. The work program for next year will fund research and innovations in the area of big data. As I mentioned, the mobile phones, the smartphones are producing a lot of data that can be of use, particularly for public health. Also, a systemic approach to cybersecurity for health, so not just looking at a app, at a set of health records in one place, a transfer of data, but looking how we can, with perhaps new technologies, ensure security of the entire system, from the smartphone to the hospital to the cross-border transfer. So we're challenging the researchers, especially from the cybersecurity area, to see what kind of solutions they can provide for the sensitive area of health data. Patient empowerment, digital health literacy. Obviously, when we move services to the internet, to the eHealth or mHealth, it cannot go without the citizen. We have to pay particular attention to vulnerable groups, make sure that there is the literacy to both use the digital solutions and also to know how to use things like, for instance, an electronic health summary. Workforce skills, it's important. This is not only a question of serving our citizens, the patients better, but it's also a question of competitiveness. Many areas in the world are moving to use eHealth and mHealth more, so making sure that our nurses, our doctors, our other, participants in the health systems and in the ecosystems do have the skills that they need. And together with the World Health Organization and the International Telecoms Union, It's to also show that we're not duplicating the work, we're working together to the other international organizations that our member states are members of. We're going to establish an EU innovation hub on eHealth, particularly to address non-communicable diseases and to share evidence on which approaches work, which initiatives work, where there is, again, evidence to prove that they might be utilized elsewhere. And thank you for your attention. Feel free to write to me at this email or to follow me on Twitter. And of course, I'll be here for the discussion as well if there's any particular questions. And thank you again for the invitation.
We have time for a couple of questions, Pēteris.
Okay.
I like very much your talk because it gives a great overview of what's going on the EU level. I have a couple of questions, especially when you think about State Secretary Stroppe. To which country should he look at? Which are first in class while thinking about eHealth and mHealth?
Well, this is a difficult question to answer politically correctly, but I can give a number of examples. I think for a country with a very high level of healthcare, Denmark is a very interesting example. They have digitalized most of the healthcare records. They've moved to what is called the hospital of the future, doing more care outside the hospital and looking for more efficiency, but at the same time reaching the patient. And I mean, they're a smaller country than you are, but of course they have islands, they have areas that are harder to reach, so also having a more patient-centric approach. Another interesting country which has a much lower income level, but has done a very efficient job of utilizing eHealth in order to deliver services better is Estonia, that has introduced e-prescription close to 100%, and I think they have some eHealth records, not all the records, but some eHealth records on about 90% of the population. So with a fairly low level of spending and still with lower health indicators than you're achieving in Germany, they are getting a very good result for that level of spending. You also have countries like Sweden who have done interesting things, and Finland, and have experience. And then, as you very well know, like in your country, a lot of the healthcare responsibilities are regionalized. So even in countries that perhaps as a whole are not as interesting, as an example, you have places like Catalonia, or Lombardy in Italy that have done a lot because of the regional responsibility that they have for health. So hopefully that was politically correct enough example. And of course, we're always there at the European level to try to help in sharing experience. And there's also the eHealth network that Germany participates in, where all the member states come together to discuss issues like interoperability. And now we have a new group on mHealth.
What are your thoughts about, you spoke at the end about generating evidence, but how could you generate evidence if technology is changing so quickly? If you have, for example, apps changing every 3 months, you get a new release. What kind of approaches, because traditional randomized double-blinded trials most probably are not the way to get evidence. Do you are working on tools for gathering evidence?
I mean, this is one of the challenges with the digital area. As you very well know, things are changing very rapidly. I mean, there are areas where we do have an experience and which I think are most of all based on information sharing or efficiency. The e-prescription, it reduces the errors of the famous, I don't want to, perhaps say this in a room full of doctors, but the perhaps sometimes difficult to read handwriting of the doctor. The number of errors is reduced, and the efficiency gains are shown in a number of countries, both for the pharmacies, the individual patients, and the whole system. The other is the electronic health records. Obviously, if you're also even traveling within your country, or you're traveling in another country, and you have a problem and you have some allergies which might affect your care, it is very helpful for that doctor to have a copy of your health records immediately and not have to interview you while you're waiting. Then when you go into specific apps, then there are tests which are not randomized clinical trials, but in areas like mental health and so on, where you can show, and there are cases that you have less recurrence, you have a better result, adherence to medication as well. So it's a question of looking at what tools we have and which fit best the part of digital health, because in a way, digital health is just as complex as health in and of itself. In the area of, for instance, in silico medicine, the virtual physiological human, this is the modeling of the organs and so on. There is discussion within that scientific community and with us at the European Commission that perhaps these models should be treated like pharmaceuticals and should go through that kind of validation, because it is that serious level of work, and they will only be really utilized at scale if health systems, if hospitals are completely convinced that they are viable and valid for, all situations and under all kinds of stress.
You have examples how other countries get apps and other innovations into the payment systems, because we have very rigorous payment systems. It's very hard, in a sense, to adopt the payment systems to a very fast-changing innovation area.
I think this is very generally an issue for everyone. As you said, perhaps the apps are changing rapidly. And what makes the apps complicated, and why there's a very good reason for collaboration between the European Union and the member state level, which we're doing in this eHealth group that I mentioned in the eHealth network, is that it's not so much the cost of the apps. Many of them are almost for free. Obviously, it requires some kind of money and some kind of investment to develop them, and they have to have a business model. Right now, often the business model is, you. Nothing is for free. It's your data. So there is a question that the citizen has to realize as well, that it's free. Okay, I don't need it to be reimbursed, but you should be clear whether this is exporting your data to other countries. If you're worried about this, of course, we have to look to the, freedom of the citizen to make decisions that they want to, but that often it is the idea that it will use your data in a certain way. So we have to make sure, and that's what this code of conduct is aiming to do, to make sure that citizens understand what is being promised to them by the apps developers, by the responsible ones. Where they're not responsible, the citizen can make the choice, and maybe a member state can shut them down. And as the business model develops, we might see more and more serious apps get more and more expensive, and either the state or the individual citizen will have to pay for them. Or it will be considered, okay, I'm fine with you using my data on whether I'm going to contract diabetes or whether I'm depressed, or I think many people in Europe would not be so happy with that. So it's really assessing what the apps are really doing and then coming to a societal European national consensus of where and how we want to pay as individuals or as societies.
The floor is open for a couple of questions from the audience, and please indicate where you're coming from. Well, where are the questions? Maybe they come after the next talk when we first hear Paul Grandi from IBM, and then, no, we have one question, so the icebreaker.
Michael Blasius, I have a question. You're head of the Unique Health and Wellbeing, and we know that the European Commission, as well as the WHO, as well as OECD, are doing a lot of work in the direction of well-being. Perhaps you can give us a brief introduction of the distinction between health and well-being from your perspective, not only physical but also financial, social, community well-being in comparison with the health.
Very, very gladly. Health encompasses what sometimes you can call sick, the treatment of people who have an ailment, a sickness, as well as the prevention. Let's make sure less people get diabetes, less people are obese in our societies, these challenges we're facing now. And the well-being obviously plays a part in that as well. It's, are people exercising, sleeping well, eating well, but going a little bit further into the things that would not come under medical law, health law, medical devices. Further, it's the areas where it's the potential of the digital economy for a life well lived. utilizing the apps for not just your steps, but maybe if you're going cycling in the countryside, if you're looking for new places to have healthy organic food, again, that fit into a lifestyle that can be broadly said as one of well-being and health. And then obviously there's both a public sector innovation and a commercial side to it where our entrepreneurs in our public sector can participate. As well, my unit has the aspect which I signaled with this upcoming public consultation on the apps and the non-embedded software of the effect of digital on people's well-being. So it's something that in this area on the so-called bad apps or perhaps bad 3D software printer models, we've started to explore, but potentially as well the effects of the 24/7 online digital lifestyle on both productivity and how people are feeling. So moving into these different areas, is it good for us? Whether we should follow some of the, I think, recommendations that we have from Germany and others that, at work and so on, the mobile devices and other, internet emails should be turned off. Also moving and assessing this, again, without doing things that we as the European Commission shouldn't do and that are up to the member states and the regions.
Thank you so much.